Andre. Today I have a special assistant, this guy. I don't know, have you seen it before? It's a little model for our acupuncture meridians and acupuncture points. Today we're going to talk about knee pain. So recently, a couple months ago, I had a male patient who's around 19 years old. He had experiencing knee pain around basically the lateral side of his knee, so these two sides. And in the first treatment, I kind of quickly checked the muscle around his thigh and found the muscles on these two areas are very tight. So very tight string along here and also along here. And so his knee pain is mainly on the lateral area, right? So the reason the knee pain is this because the muscle is being too tight. So this muscle kind of cramps, tightens up, pulls the kneecap upwards and causing more stress in this area, more tension. That's why he had pain in this area. So the first treatment I did palpate along the muscle and placed needles wherever there's tender points. So after first treatment, he came back next week. He said the pain is so much better. He was really happy, and but he still experienced some discomfort after sitting for a long time there, because he's young. He likes to play games on computer or play board game with his friends. So whenever he sits for a long time, he would get knee pain and discomfort. So after a couple treatments, I noticed we kind of experienced some sort of plateau, and that's when I realized, okay, maybe there's more to it than this muscle. So when someone sits for example, at an office job for a long time, or for someone who sits for a long time, their glutes, the muscle around the butt, can be very, very tight. So if this muscle is tight, it can kind of pull on the muscle at the front where he had the issue. So because needling the butt is kind of inconvenient, especially if I have a female patient. So there's another way to go about it, is to needle the upper arm, the deltoid area, because imagine if humans are four-legged animals and we walk with four legs, the shoulder and the hip are very similar. So we can use shoulder to treat hip or hips to treat shoulder. So in this case, I use the tender points around the deltoid to treat the muscle on his glutes. So that treatment, I added more points on both sides of his shoulders, and the next time he came in, he said it's getting better again. So when we reached a plateau, it was kind of flat, about the same, and then as soon as I started treating the deltoids and the glutes, and he was much better. So in the beginning, we did like a weekly treatment, and after that, after a week of being okay without experiencing any pain or discomfort, I kind of sort of slowly phased him out to every 2 weeks. And after 2 to 3 treatments and without any pain, we were able to extend the gaps between treatment to 1 month, and now he's on a bi-monthly basis, so he comes in every 2 months to kind of like a maintenance and also help him deal with preventative to prevent more further knee pain. So that's quite simple. A lot of knee pain cases are like that. So you don't necessarily, when you needle only the knee, it's gonna relieve the pain in this area, but you have other issues causing the knee pain. If you're not addressing that, your therapeutic effect is going to be very limited. And also, a few months ago, there's a lady who had also had knee pain, but her issue is a little bit different. She had more pain in the medial side of her knee, and medial side and also around it. And so after a couple treatments, she said, okay, the pain is almost gone, but I still have a little pain left on this side. So when I look at this area, I found there's a lot of purple veins and superficial purple veins. That means the blood flow in that area is very good. So what I did a couple pricks along the purple veins to let out some blood. So imagine like you have a pipe that's clogged. You're just looking for a way out to let the water clog in the pipe to release. And once the clog is released, the pipe can restore the water flow. So same thing with blood vessel. After I did that, the pain diminished right away. So I think that's pretty straightforward with the knee pain. Unless you have more severe knee issues, like when your meniscus is completely worn out, or you're on like a bone on bone kind of situation, then it can be a little bit more complicated and requires a much longer treatment. Other than that, it's pretty straightforward. And one thing you can do at home if you have just a kind of minor discomfort with your knee after exercise or after sitting for a long time, what you can do is there are 2 points on your middle finger. So the second, between first and second knuckle, this section of our finger, you see 2 blue dots that I did. Sorry about giving you the finger, but so just in the middle of this section, so in halfway between the section, 2 points right next to your finger bone, your phalangeal bone. You kind of just use the nail, two fingers, use the nail to kind of stimulate, to press on the point, and to simulate the acupuncture point to improve the circulation of your knee. And at the same time, when you're stimulating your finger, you want to move your knee, move your legs, to kind of improve the blood flow, telling your body, okay, this is supposed to help my knee, not other stuff. So after about a minute to 2 minutes, you should feel some relief. If you're still having more pain, then you should go see your acupuncturist, or you want to come see me, that's okay. So that's it for today about the knee pain, and if you have any comment or question, feel free to leave it below. And that's it for today. See you next time. Bye.